From the School of Rural Public Health at the A&M Health Science Center is Dr. Marcia Ory. Sorry, I always try to include that because there are so many great agencies involved in this project. And
thank you.
It's great to see those numbers on the decline. And it is such a great decline, it seems like. But of course, there are other numbers that either didn't show any improvements and actually got worse. So what can we do to keep this number lower, but continue that trend as they get older?
This is so promising that we can actually do something to reverse the trend. And we've been doing things. We've been doing things in the Brazos Valley and in the state. And let me just give you an example. Have you been down to downtown Bryan lately? Have you seen those walking trails and the signs?
Yes.
So that's one thing that can be done. Other kinds of things we did last year, the year before, we had youth learning about what would make a difference in their community. We had them go around their schools, go around their neighborhoods, and see what could be done. Small things, crosswalks. Why are kids obese? They're obese because they're not getting enough physical activity or they're eating too much. And so there are a lot of things that are done, policies at the state level. We're actually doing a study that's called Safe Routes to School. How can you make it more likely that kids will walk to school these days? But the study has to do with preschoolers, and what we see there are national policies, and we're actually studying one. It's WIC for low-income kids. They're now saying, let's have more fruit and vegetables, let's have low-fat milk. So there are actually things that can be done, and I think that's what's so exciting about these findings, is we can make a difference. And even in those groups that didn't decrease, they didn't go up. And what that shows is at least we're reversing this trend that has been going up for the last generation.
Because it really is such an epidemic and can have such severe consequences for our health. And it seems like we like to joke about things that it's not rocket science. This doesn't seem like it's so far-fetched.
This is public health. It is absolutely the kinds of things that will make a difference are really public health matters. It's eating better food. It's being more physically active. It's having schools that have PE where it's active PE. It's having child care sort of turn off screens and TVs, so cutting that screen time, having kids be more active. It's things that you know need to be done. It's just making them happen.
At school you're getting that exercise, but at home they're not. Then it may not be as beneficial if only one part of the child's life is.
It is so important to think about a person's whole life. It's what they do at school. It's what they do at home. It's what they do in their community. And you can have small steps in every single area in which you live.
And of course, one of those, Dr. Ory, is maintaining an active lifestyle. And we want to give you a heads up about Thursday because we're going to have a special group of superheroes. They are called Super Sprouts, and they are encouraging kids to not only change their eating habits, but also get more physically active. And you know what? They've been endorsed by First Lady Michelle Obama.
Excellent.
And they've got a chance to hang out with former NBA star Shaquille O'Neal. One of those heroes will join us this Thursday to help get our kiddos more excited about working out and eating healthier. And Dr. Ory, we appreciate you joining us this afternoon, and we hope lots of people will consider changing their habits for the better.
Thank you. And make it fun. I mean, that's the key. Make it fun, and people will want to change.
Thank you.
Thank you.